DESIblitz.com.
Year 2020 and going into 2021 has been a difficult time for a lot of us working in the NHS and in the health sector. We have dealt with a lot of real illness and really a lot of sick people that we've come in and seen through hospitals. Unfortunately, we've also seen a lot of our colleagues suffer from COVID-19, and in some instances we've actually seen deaths amongst our colleagues as well, which has been a very, very difficult aspect to deal with. At a personal level, we are having to deal with it on a day-to-day basis. When we are working on a full COVID-19 area, which is very high infection states, you have to make sure when you're getting home, you're protecting your family as well as yourself. In some instances, I know colleagues who've had to move away from their main place to make sure their families are protected. When we are going home after working on a busy shift around here, we have to make sure we don't actually take the virus home to our families, and actually making sure that we are looking after ourselves and our families, as well as dealing with the aspects on a daily basis at job.
कोविड के दौरान हमारा जो रोटा है वो कोविड रोटा में तब्दील हो गया. हमें लगातार 4 दिन 12.5 घंटे काम करना पड़ा, और उसके बाद हमें 4 दिन ऑफ मिले ताकि हम अपनी दोबारा एनर्जी रीगेन कर सकें फॉर अपनी नेक्स्ट शिफ्ट्स के लिए. ज़ाहिर बात है, इस 12 घंटे की शिफ्ट में जो लगातार 4 दिन करने थे, उसमें पेशेंट का वर्कलोड, डिसीजन लेना उनके बारे में, उन्होंने ITU में जाना है और उन्होंने वार्ड बेस्ड केयर के लिए रहना है. डेफिनेटली वर्कलोड बहुत बड़ा, जो कि एक मेंटल स्ट्रेस भी था. बट मैं इसमें आपको ये कहूँगा कि हमारे सीनियर रजिस्ट्रार, हमारे प्रोफेसर ने हमारी साथ रहे और हमें हर मौका पर सपोर्ट किया.
COVID-19 has been a game changer within the medical profession. I can say confidently that in my 25 years of career as a doctor, I haven't seen anything like this. This has been unprecedented, and perhaps, and we hope that we won't see anything like this in future. It has changed the way we think about medicine, we behave both as as a person as well as in the profession. We have seen people suffer. Managing people with COVID has been a very stressful thing as well, and it has had an impact both on the physical and mental health of all the people, including doctors and nurses, as well as the general public, of course. We have learned quite a lot, that we cannot take many things for granted. We have to follow certain rules with regards to infectious diseases, particularly maintaining some social distancing and making sure that we maintain good hygiene. And these have been some of the things that we have learnt in medical school, but we haven't seen the impact of it never before, as we have seen with COVID-19 infections.
So we, as healthcare professionals, as medical doctors, we do have to deal with grief and loss on a basis that we are seeing people actually suffer from a medical condition that in some instances they may not recover. In my other role, I also deal with some of the junior doctors and look at their educational aspects, and some of the impact I've seen on junior doctors working actually in the NHS has been really immense, and it's been heartbreaking seeing some of the mental health aspects. And I think the thing to say here is that a lot of these aspects we are going to be looking at dealing with for years. This is not just suddenly going to go away, and I think we have to look at how actually we can support the NHS and our colleagues from recovering from this on a long-term basis.
इसके बारे में अभी भी बहुत सी जगहों पर रिसर्च हो रही है कि किस मौजूदा बीमारी में कोविड ने ज़्यादा इफ़ेक्ट किया, पर अभी भी हम कोई एक स्पेसिफिक बीमारी का नाम नहीं ले सकते. कोमॉर्बिडिटीज़ में जो सरे फहरिस्त हैं उसमें हाइपरटेंशन, डायबिटीज़, कार्डियोवास्कुलर डिजीज़, और जो पेशेंट कैंसर वाले पेशेंट हैं जो कि इम्यूनोसप्रेसेंट ले रहे हैं. कोविड ने इन तमाम बीमारियों को जो है और इन तमाम पेशेंट्स को जो ये बीमारियाँ रखते थे उनको बहुत बुरी तरह से मुतासिर किया.
We've had COVID-19 in the first wave in March 2020, and we started seeing seeing a lot of patients coming into the hospital. Diabetes and obesity were two common factors which we found in many of our patients. And when we looked at the data in June 2020, in a matter of only 3 months, 40% of our patients were people with diabetes. So diabetes is fairly common in our patients. And many of the patients, 20% of the patients who get COVID-19 get admitted to the hospital. Everybody has a different type of clinical course. Some get better, fortunately, because they have good immune systems and have the ability to fight the infection. But about 10% of them fall really, really ill. And these are the patients we've been struggling to manage because there are no active treatments for COVID. And in the initial stages, we didn't have very much to offer to patients apart from oxygen. And if they got really unwell, we had to admit them to intensive care.
So I work in the Department of Diabetes and Endocrinology here, and we have seen a massive impact from the diabetes services, and also with people suffering from diabetes or having diabetes conditions actually having a higher risk from COVID-19. Not necessarily that they are going to catch COVID-19, but more that if they do get COVID-19, there is a higher risk of them getting complicated COVID-19 and actually in some instances not recovering from COVID-19. We're also seeing some of the aspects alongside diabetes, for example, existing other conditions like high blood pressure, problems with the kidney disease, some of the other conditions which we have seen having an impact and perhaps having a higher risk of people dying from COVID-19 if they have these conditions. If we talk about even our local experience here in Birmingham within our own organization, what we've seen is that people who are from the South Asian ethnicity who are coming in with COVID-19 have a higher risk of diabetes and are also presenting at a much younger age but are much sicker. So those are some of the features which we've seen locally within Birmingham as well.
दो एस्पेक्ट्स जो हैं उन पे काफ़ी फोकस किया है. पहला प्रिवेंटिव और दूसरा क्यूरेटिव. सो प्रिवेंटिव में हमारी पूरी टीम इन्वॉल्व हैं जिनमें इन्फेक्शस कंट्रोल की टीम इन्वॉल्व है. सो हमारा पूरी कोशिश है कि हम लोग जो कोविड है वो कोविड ट्रांसमिट ना हो फ्रॉम कोविड पेशेंट से नॉन कोविड पेशेंट. हर जगह पर जो है पोस्टर्स हैं, हर जगह पर हमें उन्होंने गाइड किया है कि हमने कौन से इक्विपमेंट यूज़ करने हैं वार्ड बेस्ड केयर के लिए, कौन से इक्विपमेंट यूज़ करने हैं हमने जो है ICU में जाने के लिए. जब पेशेंट से कोविड से कॉन्टैक्ट करना है प्रॉपर PPE हमने पहनना है, हाथ बार बार धोने हैं, हैंड सैनिटाइज़र का जो है पूरा इस्तेमाल करना है. ये तमाम चीज़ों को उन्होंने यकीनी बनाया है कि ताकि हॉस्पिटल में जो है इसको पूरी तरह से कंट्रोल किया जा सके. और दूसरा एस्पेक्ट जो है वो है क्यूरेटिव. अब इसके लिए भी प्रॉपर एक हॉस्पिटल की गाइडलाइन है जिसको सब जूनियर से लेके सब कंसल्टेंट्स लेवल तक उसी गाइडलाइन को फॉलो करते हैं. जब एक कोविड पेशेंट हॉस्पिटल में आता है उसका डिपेंड करता है कि उसकी सिचुएशन क्या है, उसको ऑक्सीजन जो है वो रिक्वायर्ड है या नहीं रिक्वायर्ड. सो अगर तो पेशेंट सिक है और उसको ऑक्सीजन की रिक्वायरमेंट है देन हमारा एक प्रॉपर प्रोटोकॉल है. हम स्टेरॉइड्स जो है डेक्सामेथासोन पेशेंट को देते हैं. उसके अलावा हम देखते हैं कि पेशेंट को एंटीबायोटिक की भी ज़रूरत है कि नहीं. उसका एक सर्टेन उसका भी क्राइटेरिया है. उसमें हमने पेशेंट्स के ब्लड्स को देखना होता है, उसके एक्सरे को देखना होता है, कोई सुपराइडेटिव इन्फेक्शन तो नहीं पेशेंट को. फिर हम जो है वो एक स्कोर होता है उसके अकॉर्डिंग कैटेगराइज कर पेशेंट को जो है एंटीबायोटिक स्टार्ट करवाते हैं.
20% of the patients who get COVID-19 get admitted to the hospital. Everybody has a different type of clinical course. Some get better, fortunately, because they have good immune systems and have the ability to fight the infection. But about 10% of them fall really, really ill. And these are the patients we've been struggling to manage because there are no active treatments for COVID. And in the initial stages, we didn't have very much to offer to patients apart from oxygen. And if they got really unwell, we had to admit them to intensive care. There are times when people have managed to recover, and this is with good nursing care, good support with oxygen. But there are times when we haven't been able to save lives, and that has been the hardest part. And quite a lot of the times, people who are older and tend to have poor control of their diabetes are the ones who are worst affected and do not make it either in the intensive care units or even on the wards make a good recovery.
हमारे ट्रस्ट ने शुरू किया है एक मेडिसिन है जिसका नाम है टोसिलिजुमैब। ये प्रीवियसली ये मेडिकेशन रूमाटाइड आर्थराइटिस के पेशेंट में जो है वो यूज़ होती थी। हमने ये फाइंड आउट करना होता है पेशेंट्स में कि इस पेशेंट को वार्ड मैनेजमेंट की ज़रूरत है या ये पेशेंट को क्रिटिकल केयर की यूनिट ज़रूरत है। वो डिसीजन पूरी एक मल्टी डिसिप्लिनरी टीम बनाती है जिसमें कंसल्टेंट्स, रजिस्ट्रार, जूनियर डॉक्टर सब इन्वॉल्व होते हैं। फिर हम डिसीजन लेते हैं कि ये पेशेंट वार्ड में मैनेज हो सकता है, और अगर नहीं हो सकता देन हम ITU की सपोर्ट लेते हैं और वहाँ पर वो इन्वेसिव और नॉन इन्वेसिव टेक्निक्स के साथ पेशेंट्स को बेस्ट क्योर जो है वो प्रोवाइड करते हैं।
The first step would be generally doing some investigations and managing them supportively. If they require oxygen, we would be giving them oxygen. They might require some antibiotic treatment because of superimposed infection. And a lot of times their diabetes might get more difficult to manage. So they might need to be, for example, treated with things like injections of insulin while they're admitted in hospital. We also have seen good outcomes with treatments such as steroids. And there are some other newer treatments in terms of medications as well, which are coming around. Unfortunately, in some instances, these treatments do not always lead to cure from the COVID-19. And some instances, people do need to go beyond sort of medical admissions area or admission medical wards to intensive care units or critical care units. And again, in the critical care units, in some instances, they might need to go on to things like artificial breathing machines or ventilators. And some people do recover from that. Unfortunately, in some instances, they do not recover from that.
मैंने बहुत से पेशेंट्स ऐसे देखे जो इस सब ट्रीटमेंट के साथ जिनको मैक्सिमम रिक्वायरमेंट ऑफ ऑक्सीजन थी, वो यहाँ से क्योर होकर वो अपने जो है घर डिस्चार्ज होकर गए। और बहुत से पेशेंट्स ने हमें जो है वो शुक्रिया के जो है वो कार्ड्स जो हैं हमें हमारी वार्ड में भेजे विद बुके के साथ। तो ये अब एक अच्छा साइन है कि हमारा सक्सेसफुल जो रेट है कोविड-19 को क्योर करने में, मैं ये देख रहा हूँ कि ये दिन ब दिन बेहतरी की तरफ जा रहा है। और जो ट्रेजिक स्टोरीज़ हैं, डेफिनेटली कोविड में मैं काफ़ी डिसअपॉइंटेड भी हुआ। कुछ ऐसे पेशेंट्स भी हैं कि जिनको मल्टीपल कोमॉर्बिडिटीज़ थी और कोविड की वजह से वो जो हैं वो इस दुनिया से वो रुखसत हो गए। हम उनको नहीं बचा सके, हालांकि हमने अपनी पूरी कोशिश की जितना मैक्सिमम हम कर सके थे। तो डेफिनेटली एज अ ह्यूमैनिटी जो है वो आप सैड फील करते हो अपने पेशेंट्स के लिए, पर हमारी पूरी कोशिश है और हम पूरे पॉजिटिव हैं।
We have seen that in clinical trials, the vaccine has been very effective and gives up to 95% protection in certain types of vaccine. But of course, we use about 3 different types of vaccine in the UK. Most of them offer about between 75 to 80%. Not only that you get protected from the disease, but your possibility of transmitting the disease to others is also decreased quite significantly.
वैक्सीन जो है वो डेफिनेटली जो है वो प्रोटेक्टिव है फ्रॉम कोविड-19। हर इंसान को जो है कोविड-19 की वैक्सीन जो है वो लेनी चाहिए। ये एक प्रॉपर अथॉरिटी और प्रॉपर अदारे से जो है वो अप्रूव होने के बाद पॉपुलेशन में आती है और इसके प्रॉपर ट्रायल हुए हैं और वो बहुत जो है वो सिग्निफिकेंट सक्सेस के साथ हुए हैं। बेसिकली आपको प्रोटेक्ट भी करेगा और ये क्रिटिकल इलनेस से भी आपको सेव करेगा।
The vaccines, it's important to remember, will take a few weeks to start effect. So one of the messages which I would always say to people is when you've had your dose, for example, of the vaccine, don't think straight away the protection is going to kick in. It does take about 3 weeks for the prevention to actually be at its peak.
I'm aware that there are lots of rumors about the vaccine, that it's not safe. There are some kind of nanotechnology particles included in the vaccine that will track us. Fortunately, they're not true, and they do not have any evidence. So vaccines are absolutely safe. So I cannot overemphasize the fact that vaccine is an important way to protect ourselves, our families, our friends, and as well as the whole of our communities.
What we've seen locally amongst the South Asian population is that the people who are presenting with COVID-19 are presenting with more severe illness at a younger age. And that's been one of the classic common features which we've seen in our local population. Because of the area that we cater for here in Birmingham, we have seen a lot more younger, sicker patients coming into hospital with COVID-19. with the South Asian populations, there are unique aspects in terms of how we live, the jobs that we do, which would always have an impact on the services and actually how the risk of COVID-19 remains, particularly with regards to things like multi-generation households, the kind of lines of job in which we work. So these aspects will always have a slightly higher risk for the South Asian populations from COVID-19.
I think the biggest threat for British South Asian community is the fact that they have very high levels of type 2 diabetes. And that automatically increases their risk of getting COVID-19 infections. Within South Asian communities, we also need to be aware that we have culturally, we do have a lot of socializing. We live in multi-generational families. So all those things can automatically increase the risk as well. I
am aware that there have been some concerns in social media about some of the primary care services and some of the secondary care services, but I can straight away reassure people that our services are open. And if somebody needs the support, we are there to provide the support. Our support services have worked in a mixed way. So if somebody has to be seen, for example, we can actually see them. If we can provide virtual review for someone, we can provide virtual review as well. And it's a similar structure in primary care as well. They can see people on a face-to-face basis if needed, or they can provide virtual reviews as needed. In terms of managing the diabetes, I think while we are dealing in the middle of this COVID-19 pandemic, I think there will be a mixture of services. Some of the services, I think it's a good opportunity to actually streamline them and see what we can offer virtually. And I think a lot of my people living with type 1 diabetes, who I sort of look after, for example, have actually really enjoyed being able to have a virtual review and not having to actually come in with hospital parking and all the rest of the aspects which you have to deal with for your appointments when you come in. But at the same time, we are also there to provide face-to-face services, and we are there if anybody wants to come in and has to be seen on a face-to-face basis.
Yeah, some of the ways in which we are supporting our patients with the type 2 diabetes and with type 1 diabetes is we are trying to make contact with them through the telephone. And I must say that initially patients were struggling to understand this kind of consultations, but now more and more people are able to pick up the phone. In fact, it's making it more convenient for some people because they have a family member around who can discuss this. And I would encourage them to make sure that they attend these appointments and take the advice, because some advice is still better than nothing. We're also looking at some video consultations, and we are trying to promote lots of information through different websites so that patients are not completely deserted and not getting the advice that they definitely deserve. Many of these viruses tend to remain for a long time in the community. We've been lucky that we could eradicate polio, but I think COVID-19 is a different virus, and it's very likely that it is going to stay. We hope that over time, populations become more immune and develop the ability to resist these infections. But equally, the virus can mutate as well. So as long as the mutations are not very serious, then we may still be able to cope with it, which means that like just you take the flu vaccination every year, we may have to take a COVID vaccination every year. But if the mutations are more serious, then we would have to see how we can tackle that. At the moment, we don't have an answer, but we just have hope that that doesn't happen.
We are probably going to be looking at a lot of virtual working moving forward. I think virtual working from home in a lot of sectors is not going to go away. COVID-19 has actually in some instances showed some of the benefits of being able to have a more flexible way of working, and I think that would remain the case even afterwards. In the medical field, I can see a lot of, for example, education sessions that we tend to run for medical teams and other sort of nursing staff, paramedical staff and everything, which can be run virtually. And one of the advantages of these sort of aspects are you can always then go back and look at those sessions and keep yourselves refreshed afterwards. Traveling is probably going to be one of the things which will be interesting to look at how it evolves, and that will be a fascinating one to watch out for, to see how COVID-19 travel impact plans out moving forward, and what it actually means for any of us who are looking at traveling in the near future.
We need to be mindful that we have still not won this war. We are still fighting it. So the COVID-19 has not gone away, and we cannot lower our guard. We still need to be very careful in practicing the social distancing, hand washing, and of course the vaccine is going to help.
आखिर में मैं अपने यूनिवर्सिटी हॉस्पिटल्स बर्मिंघम के तमाम की वर्कर्स, जिसमें स्वीपर से लेके प्रोफेसर्स तक, सबको खराज तहसीन पेश करता हूँ कि इस पेंडेमिक के दौरान जिस तरह से हम लोगों ने काम किया एज अ टीम वर्क, हम लोगों ने दिन रात मेहनत करके हम लोगों ने पेशेंट्स अपने मैक्सिमम उनको जितनी फैसिलिटीज़ दे सकते हैं हम देते रहे हैं, हम दे रहे हैं और हम आगे भी इसी तरह काम करते रहेंगे। इस मौके पे मैं उन लोगों को भी याद करूंगा, अपने उन कोलीग्स को जो इस वॉर के अंदर अपनी कीमती जानों का वो अपनी गंवा बैठे। उन्होंने भी हमारे साथ उसी तरह काम किया, उनकी जितनी भी तारीफ़ की जाए वो कम है।